Her presentation, she was chronically ill looking, marked weight loss. There was an incidental finding of an anterior neck swelling in the clinic that moved with swallowing and all that. And then cardiovascular examination revealed that she had tachycardia with a grade 3/6 pansystolic murmur, but other examination findings were normal. So I just want to stress the fact that she presented with symptoms that were not really related to thyroid toxicosis in that sense. So she was being managed for the chronic diarrhea, she was being managed for the chronic weight loss. In fact, she was referred to the surgeons in UNTH for a colonoscopy because of the frequency of the passage of loose stools. But that incidental finding of a neck mass helped us to clinch the diagnosis. So our diagnosis was thyroid toxicosis, probably secondary to Graves' disease with thyrotoxic valvulopathy. She was investigated. Next slide, please. Her thyroid function test, as you can see, was indicative of thyroid toxicosis. She had elevated free T3, 2 times the upper limit of normal. She also had elevated free T4, which was about 10 times normal, and TSH was markedly suppressed. So we see that this is in keeping with a primary hyperthyroidism. In children, the commonest cause is Graves' disease. Thyroid ultrasound scan showed a diffusely enlarged thyroid gland, and then echocardiography showed severe mitral regurgitation. Next slide, please. We have beautiful pictures of this patient, but unfortunately, her father was reluctant to give to give consent. Well, currently she's being managed by the pediatric endocrinology team. They've gone back to Cotonou where they reside, and so we have a lot of virtual meetings. But however, she's scheduled for a physical visit soon, and we hope to repeat her echocardiography at her next visit. Next slide, please. Next slide. And Eltek et al. Documented the most frequent cardiac manifestations of thyroid toxicosis: palpitations, tachycardia, exercise intolerance, dyspnea, and orthopnea. Next slide. And echocardiography and ECG are very important, of course, as we all know, for diagnosing these cardiovascular pathologies. Echocardiographic findings range from demonstrating regurgitant flow, especially in the mitral valve, like in our patient, to structural changes such as valve prolapse. And ECG may show atrial fibrillation. Next slide. And the good news is that prognosis is very good in children with valvulopathies, because most of these valvular manifestations are functional and tend to resolve with treatment of hypothyroidism. In severe cases, however, treatment may require use of diuretics and anti-failure regimen if the children present in failure, and rarely these children may require valve replacement surgeries. And so we're hopeful that when we repeat the echocardiography for our patients, it would show normal valves since she has the hyperthyroidism has resolved, at least biochemically. Next slide, please. So in conclusion, a very high index of suspicion is required in children with hypothyroidism. A thorough physical examination and a thorough cardiovascular system examination is essential in order to identify and follow up children with cardiac complications of thyroid toxicosis. Thank you. My references.